Ladies and gentlemen, welcome to my first podcast on Fascination Health Psychology. In this podcast, I would like to show you which factors can decrease and increase your psychological resilience. First of all, let me focus on the topic depression and drugs. I know personally several refugees who started taking drugs in Germany. Maybe also as a way for coping with depression and frustration. Now the point is, even lighter forms of drugs are not, as could be quite harmful for you. It is known since some years that drugs can induce schizophrenia, can induce psychosis. In fact, 50% of all psychotic patients got drugs. And it can be shown that drugs can induce psychosis in formerly completely normal subjects. The point is, on the long run, the point is on the short run, when you take even light drugs as hashish, then you might feel pleasure and you see the colors more bright and you feel more pleasure and everything hears nicer, feels nicer, and thus all your worries are fading away. You have to know that drugs are changing critical functions in your brain, especially the so-called dopamine system. Here you see pictures of the dopamine concentration in the brain of schizophrenic patients and control patients. The more red, the more dopamine concentration, and the more yellow, the less dopamine concentration. Or the more blue, the less dopamine concentration. So you see that in schizophrenic patients, there is a much higher dopamine concentration, whereas in healthy subjects, the dopamine concentration is less. So when you take drugs affect and change the dopamine concentration. And you should know that dopamine is involved in reward. So, for example, if you play football and then you make a goal, then dopamine is produced in your brain. If you read something and understand it, dopamine is produced. So dopamine is involved in reward processes. So when you take drugs, even if you don't develop psychosis, then a lot of patients develop something which we call amotivational syndrome. Meaning that before taking drugs, people had motivation to go to school, to work, to wake up early. But once they take a drug, they have this amotivational syndrome where they have no motivation for doing anything. No motivation to wake up, no motivation to go to school, to go to work. Some even don't have motivation to wash themselves, clean themselves. And I know also some patients after a while who said, they call their friend and tell them, give me only one reason why it is worth living. And then they get suicidal. So, taking even light drugs as hashish can affect massively in a bad way your brain, that you will get this amotivational syndrome. And as I said, in 50% of schizophrenic patients, it could be shown that drugs trigger this disorder. And in schizophrenia, people can get hallucinations. They can hear things which are not there. They can see things which are not there. Some people even see demons. Some people say they hear voices coming out of the wall, voices coming out from plugs, and the voices could tell them, kill yourself, jump, you should burn something. It could be several voices, it could be male, female. And you should note that some patients think this has something to do with demons. The point is, this has nothing to do with demons, but you should know that you are seeing and hearing not with your eyes and ears, but with your brain. For example, when you are sleeping and dreaming, in the dream you can see and hear things which are not there outside. So it is a product of your brain. And usually you have balance in the brain between dopamine and dopamine receptors, but once you take drugs, this balance is disturbed. You have much more dopamine receptors, and then once you stop drugs, then you have a deficit and you get addicted to it. And then, as I said, several patients develop then psychosis, seeing things, hearing things. Some people also even develop paranoia, where they feel that people are going after them, they are observing them. And some people also have squirrel ideas. For example, they watch a news and the guy in the news would cough and then the patient would think this is a sign, he's sending it especially to me. So they have, they assume things which are not really there. And once patients got a psychosis, then usually have to take for the rest of their lives antipsychotic medications. Another problem is that once you get accustomed to drugs, even if at the beginning your friends give the drugs for you for free, once you get addicted, then with one step you get into criminality, because then the question is, how can you get money to get these drugs? And then with one step you are thinking, how can you steal something to get money in order to get the drugs? So then some refugees start then to steal mobile phone in the room of the others, or try themselves to deal with drugs and go into criminality to be able to get for themselves drugs. So on the short term, patients might feel happy during taking drugs, but on the long term, they are not able to concentrate, to learn, to make a good career, to earn money, to build a family, and people go into criminality, and some people even commit severe crimes. And in people who could have done a wonderful career if they would be aware of that. So if you are not addicted in drugs, be aware that it would cause severe problems for your health and your career. If you are already addicted, then the solution would be that in psychiatric clinics you can undergo there for several weeks a program where your body will get cleaned from these drugs. So you can have professional help supporting you to overcome this addiction and start a new life again. The point is also how to improve your resilience. You should know a little bit about your anatomy. So when you watch something, for example, you look at a tree, then the light will be reflected and it will come to the retina at the behind of your eyes. And then from the nerve fibers, they will get, you will make like an X, and this point is called the chiasma opticum. Then information goes to the thalamus, where a filtering happens between things you perceive consciously and subconsciously. And then the information goes further to the visual cortex, and from there to the rest of the brain. Now, at the thalamus, as I said, happens filtering, and it is then decided what you perceive consciously and what you perceive subconsciously. So therefore, if, for example, you are having a walk in nature, then it is really important where is the focus of your attention. If you are focusing on problems which happened in the past or could happen in the future, then you will not profit at all from this walk in nature. Instead, you should focus your attention on the colors you see, the sound of the nature, and then the sympathetic will really go down, and then you will profit really in a beautiful way from this training. This is a pioneering study published by Jenkins, and in the study he discovered the following mechanism. You see here the hand of a monkey, and the fingers are numerated. So you have the thumb, the index finger, the middle finger, the ring finger, and the small finger. And then you see above the representation of each finger in the sensory cortex. Now, when the monkey gets passively tactile stimuli on the fingers for hours, then this did not lead to a change in the somatosensory representation. However, if the monkey is paying attention, to this tactile stimuli, then only few hours are sufficient to induce an enlargement of the representation of the fingers in the brain. So this pioneering study shows perception is not perception. It is a big difference if you perceive something with attention or without attention. And perceiving things with attention leads to stronger neuroplastic changes in the brain than perception without attention. That means something really important which we use in all our patients, which is called in English mindfulness training. So, if I tell you, don't think of a pink elephant, you are not able not to think of something. So if the whole day you are thinking how you were misused and the traumas you had and people who insulted you or hit you, and you say, I don't want to think of them, then you are thinking of them. But you have in the thalamus something which I call like the focus of your attention. So if you make a walk with mindfulness and then focus your attention, for example, on this picture which you are seeing. So imagine you are having a walk near a river, and then you focus your attention on this river. Focus your attention, where are the waves? Are they going from right to left or from left to right? Are they going from you away or they're coming on you? Where do you see the brightest reflection of the sun in the ocean? Then look at the trees. Which color do you see in the trees? Which color do you see in the leaves of the tree? And the more you focus your visual attention on this nature, the more physiologically you can measure that the sympathicus goes really down, your body gets relaxed, and the parasympathicus is activated. And this then regeneration of your mind and the psychology starts. Then go on to the auditory channel. Close your eyes and then perceive the sound of the water. Perceive the sound of the waves. Perceive the sound of the leaves, how they are moving in the wind. Perceive the sound of the birds. And physiologically we can measure that this kind of training reduces sympathetic activity and activates the parasympathicus, which increases psychological well-being and stops stress hormones from being produced. Your heart is beating slower, you get vasodilation, blood pressure goes down, hair regeneration starts, skin regeneration starts, and then you do a lot benefit for your psychological health. And the next channel would be tactile perception. You could touch this bridge, touch the wood of the bridge, feel the heat of the sun in this wood. If you have sand, then maybe touch the sand. If the weather is good, you could also take off your shoes and socks and feel the grass below your feet. Also feel the sun on your face, which cheek is warmer, the left or the right. Feel also the mild wind touching your face. All this mindfulness training several studies have shown that it really helps a lot in increasing sympathetic activation and decreasing sympathetic activation and increasing the parasympathetic activation. The next perception channel would be, for example, smelling. Take a deep breath and realize which smells do you perceive in this air, and also how this air, how does it feel on your tongue? Which taste do you perceive? How does this air taste today? Can you taste the molecules of the water, of the grass, of the tree? And this is a wonderful training to relax again and to improve your energy. Another thing is what I would like to show you in this picture. You can see actually that the eyes actually is part of your brain. So many people, if they want to relax, what do? Or several refugees tell me they watch television and watch news on war, or watching internet people getting tortured. So these pictures enters your brain through your eyes, so you should be aware what stimuli are you providing your brain. So be aware of what are you watching at, which pictures are you looking at. And you should select, do you really want to see pictures of war, pictures of torture, because this will affect your brain. And if you want to relax, television per se is not a high priority in relaxing, especially because the pictures are coming in a specific frequency, and the visual cortex can then also correlationally fire in the same wave as the pictures coming to you. Instead of that, as I said, having a walk in nature and focusing your attention visually, auditory, and tactile is a very strong way in improving your health psychology and improving your psychological resilience. And as I said, this training shows physiologically that it decreases the sympathetic activity and increases the parasympathetic activity. Another thing is mindfulness training could be also associated with food and with drinking. And I must admit that especially in Morocco, they have a long tradition in this way of eating and drinking. So if you see only a cup of tea, how beautiful it is decorated, and the tablet, how beautifully it is decorated, and this peppermint leaves, there are over 40 kinds of peppermint, and the Moroccan peppermint has a very strong smell. So even from meters away, you would perceive the smell of this Moroccan peppermint. And when I was in Morocco, the guy who put the tea didn't put the tea this way, but he made this movement. And I asked him, why do you do this movement? And he said, we do this movement so you can hear the tea. So this is exactly what I want to emphasize here. Intuitively, they do it in a really correct way, that they enjoy this tea with all their senses. They smell the tea, they see the tea, they taste the tea, and also they hear the tea. So drinking tea and focusing your attention on the smell, the taste, the look, the sound of the water and the tea, this also will beautifully decrease the sympathetic activity and stop your body in producing stress hormones. So therefore, instead of eating and drinking in front of television, meaning you eat and drink without attention, instead, for example, if you have a balcony or a terrace, what also in Morocco they use specific smells, putting on the ground, on the pillows, and then sitting there and enjoying the tea with consciousness. And this really is a very wonderful way to decrease sympathetic activity and strengthen psychological resilience. Another important thing is having shower and bath also with consciousness. So, for example, in Morocco there is something like gloves with which you can make a massage on your skin, on your back, and this again will produce oxytocin from the hypophysis. And also you can change the temperature of the water, hotter and colder, and also paying your attention on this tactile feeling. Also, if this is your head, then change the position, that letting the water come on your neck, on your back going down. All that are wonderful ways how you can enjoy things by paying attention to them. Another important topic is sport. If you do any sport which let your heart beat faster for at least 30 minutes, twice a week, this is the best preventive training you can do to prevent depression and dementia in older age. Also, laughing and using your sense of humor is also powerful, because laughing and anxiety are not compatible. So if you can laugh, then you cannot be afraid and being anxious at the same time. Also, it is nice if you can also laugh on your problems and not taking your own self so seriously. And if something wrong happens during a day, try to take it more with irony. And last but not least, social contact. You should have several circles of social contacts. Maybe a narrow circle with friends who are so near to you that you can really trust them on everything. Then maybe a further circle where maybe you will not tell all your secrets, but maybe you could invite them, not necessarily at home, but maybe to drink a coffee or to a restaurant, give compliments, get compliments, change ideas. And also what I realized in foreigners living in Germany, that for example, Moroccans are only have friendship with Moroccans, and Egyptians only with Egyptians, and Algerians only with Algerians, and Eritrea only with people from Eritrea. Whereas it would be much better that you have really a wide social relations with people from different countries, different religions, different perspectives, which will be also challenging in thinking, that you would talk about things, change perspectives, and by that giving each other enrichment. So social contact is something very important, and we know from gerontopsychiatry, that means psychiatry in older patients, that depression and social isolation are twins. So people who are depressed in older age are usually also patients who are socially isolated. So you should train already as a young person your social competence and also your sense of humor. Right, I would like again to thank my colleagues who supported me in developing these webinars. My special thanks are for the Department for Integration and Gender Equality from the city of Reutlingen. Thank you for your attention and goodbye.